Hello everyone, welcome back to my YouTube channel. Today we'll study about antihelminthics, means the drugs which are used to treat the helminthic infections or the parasitic infections. Here are a group of antiparasitic drugs that expel parasitic worms and other internal parasites from the body by either stunning or killing them and without causing a significant damage to the host. Means these drugs are used to treat, to eliminate the worm infestations which are present in the individuals. Means those are not causing the much effect on the individuals. Okay, host. Here the classification of antihelminthics are piperagines, benzimadazoles, and heterocyclines, natural products, vinyl pyrinamides, amides, and nitro derivatives, and amide thiazole. Here the piperagines are diethyl carbamazepine citrate. This is also called as DEC, and piperazine citrate. And next is benzimadazoles. Here example for the benzimadazoles are albendazole, mebendazole, and thiabendazole. And next example for heterocyclines are oxamycin and paraxequentil. And natural products those are ivermectin and avermectin. And vinyl pyrinamides example for this vinyl pyrinamides is pyrantel and oxantil. And amides example for the amides are niclosamide. And nitro derivatives example for nitro derivatives are nitidazole and amida thiazoles. Example for amida thiazoles are levamisole. These are the classifications of antihelminthics. Next we'll see about in detail explanation about the antihelminthics. Here the first we'll study about the benzodiazoles. Here the benzimadazoles. Example for this benzimadazoles are mebendazoles. These are a broad spectrum antihelminthic, cures roundworm, hookworm, pinworm, and strongyloids infections. Okay, these are broad spectrum. Broad spectrum is nothing but these are causing the affecting on the more than the 2 or 3 bacteria infest worms. Okay, ಅಂದ್ರೆ ಎರಡಕ್ಕಿಂತ ಜಾಸ್ತಿ ವರ್ಮ್ಸ್ ಅಥವಾ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಅನ್ನ ಕ್ಯೂರ್ ಮಾಡ್ತಾ ಇದ್ರೆ ಅಂತವಕ್ಕೆ ಏನಂತ ಕರೀತಾರೆ ಬ್ರಾಡ್ ಸ್ಪೆಕ್ಟ್ರಮ್. ಓಕೆ, ಬ್ರಾಡ್ ಸ್ಪೆಕ್ಟ್ರಮ್. Here these are the broad spectrum antihelminthics, cures the roundworm, hookworm, pinworm, and strongyloids infestations. Infestations mean the presence of worms. Okay. Here the doses of these mebendazoles are 100 mg BD for the 3 days. 3 days 100 mg ಕೊಡಬೇಕು. Next 500 mg single dose. ಅಂದ್ರೆ 500 mg one dose ಮಾತ್ರ single ಕೊಡಬೇಕು. That too in a chewable tablet. And helmintol and mebendazole, these are administered 100 mg tablet, and these two drugs are present in the form of the tablets. And adverse effect of these drugs means adverse effect of the mebendazoles. Here the adverse effect are most common adverse effect are nausea and vomiting. Alopecia means sometimes if the patient is taking the prolonged period of the antihelminthics, they may be the person may go for the loss of the hair, alopecia. And abdominal pain and diarrhea. Sometimes the patient may feel the abdominal pain and diarrhea may be seen in a heavy infestations. Andre enadru worms ಜಾಸ್ತಿ ಇತ್ತು ಅಂದ್ರೆ ಅಂತ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ the patient may feel the abdominal pain and diarrhea and headache and dizziness. These are the common adverse effect of mebendazoles. Next we'll study about the mechanism of action of the mebendazoles. Here mebendazole comes under the benzodiazoles. Here the benzodiazepines bind the tubulin of the parasite with a high affinity. Okay, tubulin of the under high affinity alli parasitic tubules ಏನಿರುತ್ತೆ ಅಲ್ಲಿ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. Then it leads to inhibit the synthesis of the microtubules. Inhibition is nothing but it decreases the synthesis of the microtubules. Then it leads to these microtubules are essential for several metabolic processes in the parasites. Means once the decreases the synthesis of the microtubules, there is no any essential or several functions of the parasite. ಅಂದ್ರೆ parasite microtubules mebendazoles ಏನಾದರೂ ಎಫೆಕ್ಟ್ ಆಯಿತು ಅಂತಂದ್ರೆ parasite functions ಏನಾಗುತ್ತೆ ಸ್ಟಾಪ್ ಆಗಿಬಿಡುತ್ತೆ. Then it leads to the inhibit the glucose uptake in the parasite. ಅಂದ್ರೆ ಪ್ಯಾರಾಸೈಟ್ ಗೆ ಬೇಕಾಗಿರುವಂತಹ ಗ್ಲೂಕೋಸ್ ಅಪ್ಟೇಕ್ ಏನಾದರೂ ಸ್ಟಾಪ್ ಆಯಿತು ಅಂದ್ರೆ ಇಟ್ ಈಸ್ ಗೋಯಿಂಗ್ ಟು ಡೈ. Okay, that is an bactericidal effect. Okay, and next we'll see about the pharmacokinetics. Pharmacokinetic is nothing but what the body does to the drug. Andre once new drug enadru tagondmege body ಆ drug jodi yav tara interact agutte. Here the pharmacokinetics, it occurs on the 4 stages, that is an absorption, distribution, metabolism, then excretions. So here the pharmacokinetic is Albendazole are poorly absorbed from the gut. ಅಂದ್ರೆ guts ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ ಪೂವರ್ ಆಗಿ ಅಬ್ಸಾರ್ಬ್ ಆಗುತ್ತೆ. ಅಂದ್ರೆ 10% ಮಾತ್ರ guts ಅಂದ್ರೆ GI system stomach ಅಲ್ಲಿ ಅಬ್ಸಾರ್ಬ್ ಆಗುತ್ತೆ. And also undergoes first fast metabolism. First fast metabolism ಆಗುತ್ತೆ ಎಲ್ಲಾಗುತ್ತೆ. Albendazole is extensively bound to the plasma proteins and metabolized by the liver. Means these are going to metabolize in the liver. Then it leads to the, once the metabolism occurs, there should be an excretions. Okay, excretion, it is going to occur through the urine. This is the pharmacokinetic and the mechanism of action of the albendazole. Next we'll see about albendazole. Means albendazole is a broad spectrum antihelmenthics. It is a pro-drug and active metabolite, has a good efficacy against the roundworm, hookworm, pinworm, threadworm and tapeworm. Means it is a broad spectrum antibiotic. It is used to treat the many diseases or the many infections which occurs from the helminths or the parasites. First we'll see the mechanism of action. Means the mechanism of action of the albendazole is bind to Golgi site of tubules. Means it is going to affect the tubules of the parasites. It is going to affect the tubules of the parasite and it leads to inhibit the polymerization and assembly of microtubules cell divisions. Okay, it inhibits polymerization enadru inhibit aitu andre there is no any assembly of microtubules enadru assembly aitu andre kooditu andre there is a formation of the cell division. Okay, once you administer these albendazole, these are going to inhibit andre ivaga assembly of microtubules ಯಾವಾಗ ಅಸೆಂಬ್ಲಿ ಆಗುತ್ತೆ ಅವಾಗ ಮಾತ್ರ ಏನಾಗುತ್ತೆ ಸೆಲ್ ಡಿವಿಷನ್ ಆಗುತ್ತೆ. ನೀವು albendazole ಏನಾದರೂ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಮಾಡಿದ್ರಿ ಅಂದ್ರೆ there is an inhibit the polymerization and an assembly of the microtubules assembly ಆಗಲಿಲ್ಲ ಅಂದ್ರೆ there is no any proper cell division ಇಲ್ಲ ಅಂತಂದ್ರೆ there is no multiplication of helminths. Okay, multiplication of helminths ಅಂದ್ರೆ helminths ಏನಾಗಲ್ಲ ಮಲ್ಟಿಪ್ಲೈ ಆಗಲ್ಲ. then it leads to impaired uptake of the glucose uptake ಏನಾಗುತ್ತೆ impaired ಆಗುತ್ತೆ. means there is a changes and it leads to glycogen store depleted ಅಂದ್ರೆ glycogen ಏನ್ ಸ್ಟೋರ್ ಆಗಿರುತ್ತೆ ಅದು ಡಿಪ್ಲೇಟ್ ಆಗುತ್ತೆ. then it leads to decreased production of the adenosine triphosphate. Okay, ATP means these are the energy cells. Decrease the production of ATP. Energy illa, assembly of microtubules illa antandre there is no any cell division and multiplication of the parasites. Then it leads to alterations in the intestinal cell growth. Okay, intestinal cell growth enagutte variations agide adu alteration ago start agutte. then it lead to death of the parasites. Okay, this is the mechanism of action of the albendazole. Next we'll see about the doses. Means it is present in the form of gentle and bandy. Gentle bandy means gentle and bandy, it is available in the form of tablet as well as the syrup. 400 mg it is in the chewable tablet and 400 mg chewable tablet alli sigutte, as well as it is present in the form of 200 mg per 5 ml syrup andre 5 ml one syrup sigutte. A 5 ml at a time you should drink. Okay, and next we'll see about the adverse effect. ಅಂದ್ರೆ albendazole ತಗೊಂಡ್ರೆ ಏನೇನು ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ ಇಲ್ಲ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. those are nausea, diarrhea, abdominal pain and headache, fever, weakness, and the person may also feel the alopecia and teratogenic effects. Teratogenic effect, these are more common in the pregnant women, so that's why it is contraindicated for the pregnant women. Okay, these are the mechanism of action, dose and adverse effect of the albendazole. We'll see about the guanylyl parental vomit. Okay, this drug is also used for the worm infestations and the roundworm, hookworm, and the pinworm infestations. Here, the dose of this drug is single oral dose 11 mg per kg. Means this drug is used 11 mg per kg body weight. Okay, this is in a single dose, oral single dose. And the mechanism of action of this drug is here the parental format. It is used for and activates the nicotinic cholinergic receptors in the worms. Means in the worms these are going to affect on the nicotinic cholinergic receptors. Then it leads to cause persistent depolarization of the neuromuscular blocking agents. Okay, depolarization is nothing but a weakening. Okay, weakening, other causing the negative energy on the cells, causing the negative energy on the cells, that is in a depolarization. Then it leads to release of acetylcholine and inhibition of a cholinesterase enzymes. Okay, it going to release the acetylcholine ಅಂದ್ರೆ acetylcholine ನ ರಿಲೀಸ್ ಮಾಡಿ cholinesterase enzyme the activation ಏನು ಮಾಡುತ್ತೆ ಕಮ್ಮಿ ಮಾಡುತ್ತೆ. Then it leads to contraction and spastic paralysis of the worm. Okay, contraction ಅಂದ್ರೆ worms ಏನಾಗುತ್ತೆ ಒಂಥರ ಕಾಂಟ್ರಾಕ್ಟ್ ಅಂದ್ರೆ ನ್ಯಾರೋವಿಂಗ್, ವರ್ಮ್ಸ್ ಬಾಡಿಯಲ್ಲಿ ಏನಾಗುತ್ತೆ ಕಾಂಟ್ರಾಕ್ಟ್ ಆಗೋದು, ಕಾಂಟ್ರಾಕ್ಷನ್ ಅಂಡ್ ಸ್ಪಾಸ್ಟಿಕ್ ಪ್ಯಾರಲೈಸಿಸ್ ಆಫ್ ದ ವರ್ಮ್ ಅಂದ್ರೆ ವರ್ಮ್ಸ್ ಒಂದು ವರ್ಮ್ ಪಾರ್ಟ್ಸ್ ಏನಾದ್ರು ಪ್ಯಾರಲೈಸರ್ ಆಗಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಯ್ತು ಅಂದ್ರೆ ದೇರ್ ಮೇ ಬಿ ವರ್ಮ್ ಇಸ್ ಗೋಯಿಂಗ್ ಟು ಡೈ ಆಬ್ವಿಯಸ್ಲಿ. ಓಕೆ, ಪ್ಯಾರಲೈಸ್ ಆಯ್ತು ಅಂದ್ರೆ ವರ್ಮ್ಸ್ ಆಕ್ಷನ್ಸ್ ನಾರ್ಮಲ್ ಆಗಿ ಇರಲ್ಲ, ಆಕ್ಟಿವಿಟೀಸ್ ನಾರ್ಮಲ್ ಆಗಿರಲ್ಲ. ದೆನ್ ಇಟ್ ಲೀಡ್ಸ್ ಟು ಲಾಸ್ ಆಫ್ ಇಂಟೆಸ್ಟೈನಲ್ ಮ್ಯೂಕೋಸಲ್ ಗ್ರಿಪ್. ಓಕೆ, ಮೀನ್ಸ್ ದಿ ಇಂಟೆಸ್ಟೈನಲ್ ಮ್ಯೂಕೋಸಲ್ ಗ್ರಿಪ್ ಏನಾದ್ರು ಡಿಕ್ರೀಸ್ ಆಯ್ತು ಅಂದ್ರೆ ವರ್ಮ್ಸ್ ಇಂಟೆಸ್ಟೈನ್ ಅಟ್ಯಾಚ್ ಆಗೋದಕ್ಕೆ ಅಲ್ಲಿ ಯಾವುದೋ ಒಂದು ಕಲ್ಚರ್ ಮೀಡಿಯಾ ಏನು ಇರಲ್ಲ. ಅಂದ್ರೆ ಗ್ರೋತ್ ಅಂಡ್ ಡೆವಲಪ್ಮೆಂಟ್ ಆಗೋದಕ್ಕೆ ಯಾವ ಒಂದು ಮೀಡಿಯಾನ ನಾವು ಕಂಪ್ಲೀಟ್ ಆಬ್ಸೆಂಟ್ ಮಾಡಿದೀವಿ ಅಂದ್ರೆ ಆ ಒಂದು ಏರಿಯಾನ ಕಂಪ್ಲೀಟ್ ಆಬ್ಸೆಂಟ್ ಆಯಿತು ಅಂದ್ರೆ ದೇರ್ ಇಸ್ ನೋ growth and multiplication of the worms. Then it leads to the elimination of the worms in the stool. Okay, worms ಏನಾಗುತ್ತೆ stool ಮುಖಾಂತರ ಹೊರಗೆ ಬಂದ್ಬಿಡುತ್ತೆ. So this is a mechanism of action of parental format, and the side effects are more common like other worm infestations that are the antihelmenthics. So next we will see about the piperazine. Piperazine, here the dose of piperazine is 4 grams OD for 2 days. 4 grams is nothing but 4000 mg. 4000 mg for 2 days ಅಂದ್ರೆ daily one time 4000 mg dose ಅನ್ನು 2 days ವರೆಗೂ ಕೊಡಬೇಕು. And next the mechanism of action of this piperazine is GABA agonist action, opening of the chloride channels. Means GABA is nothing but gamma aminobutyric acid. Gamma aminobutyric acid. Okay, these agonist action opening of the chloride channels. Okay, GABA ಮೇಲೆ effect ಆಗಿ ಏನಾಗುತ್ತೆ, there may be opening of the chloride channels. Then it leads to hyperpolarization of the ascaris muscles. Hyperpolarization of ascaric muscles ಅಂದ್ರೆ ascaris muscles ಅಲ್ಲಿ ಇರುವಂತ cells ಏನಾಗುತ್ತೆ having the weakness or they may go for the negative energy. Okay, then it leads to the relaxation and decreases the responsiveness of contractile action of the acetylcholine. Okay, hyperpolarization of ascaris muscle ಆಯಿತು ಅಂದ್ರೆ then it leads to relaxation and decreases responsiveness of the contractile action of acetylcholine. ಅಂದ್ರೆ acetylcholine ಮೇಲೆ ಇರುವಂತ action ಅಥವಾ relaxations ಏನಂದ್ರೆ it is going to decrease. Then it leads to placid paralysis ಅಂದ್ರೆ ವರ್ಮ್ ಏನಿರುತ್ತೆ ಅಥವಾ ಜಂತುಹುಳ ಏನು ಕರೀತೀವಿ ಅದ್ರ ಮೇಲೆ ಏನಾಗುತ್ತೆ placid paralysis ಆಗುತ್ತೆ. Placid paralysis ಆಯಿತು ಅಂದ್ರೆ the elimination of worm in the stool. Obviously the worm will come out through the stool. And here the indication, contraindication and side effect are more common for all the antihelminthic drugs.